Hi guys, in my previous video about coronavirus, I've shown that the actual death rate is only 1%. The biggest concern that if you're gonna overload the current medical system, this can grow up to 10x. So that's why it's so important for you to stay at home and keep the spread of the virus to minimum. You've probably heard all that sad stories from Italy where doctors had to decide whether they should treat this or that patient, and they usually prefer to treat the younger one because the younger one has a higher rate of survival and the older one just have to die. No one wants to have the same situation in their own countries. Unfortunately, with all our best efforts to mitigate the spread of the virus, you can clearly see that even in Italy, after 3 weeks of lockdown, you still have 8% of increase every day. And it's same for Spain, France, Switzerland, and many more countries to come. In this video, I will try to analyze what's going to happen when the medical system capacity will be exhausted. First, let's look closer at the different stage of coronavirus. The first stage is dormant. At some point, person gets its first virus. At this point, you don't have any symptoms and none of the tests will determine that you have a coronavirus. Next stage is infected. At this point, you still have no symptoms, but if you take a test, it can determine that you're coronavirus positive. Next stage, mild moderate. At this point you will display some symptoms like running nose, some coughing, but you're still fine, and the solution for you is to stay at home and be isolated. The next stage is severe. That's where you actually develop pretty strong symptoms and you need to have a hospitalization. It's important to understand that at this stage you're still okay, but some kind of regular checkups are needed to make sure you're not going to the next phase, which is critical. The good thing about this hospitalization, you don't need much of an expensive equipment or medical attention. And it's quite easy to transform an existing building to some kind of a temporary hospital. That's not going to be a problem where medical system will collapse. Next stage is critical. At this stage, your life is endangered. And the most common problem is that you cannot breathe. And to fix this, you need to have a mechanical ventilation system. And this is our bottleneck. If you don't have any ventilation machine available, your patient will die. This is actually what's happening right now in Italy. And to avoid this problem, government needs to buy or produce as much as possible these kind of devices. The next stage is death. So the more virus you get inside your body, the more likely you will move to the next stage. If you want to move backwards, you need to reduce the number of virus inside your body. Unfortunately, there is no medicine right now which will do this. They are testing some, but it's still very preliminary. The only way you can reduce the viral load inside your body is your own immune system. If you have a good one, you will reach first or second stage and then your immune system will kill the virus and you're good. You probably won't even notice that you had anything. If you had a bad one, you will gradually go from stage 1 to stage 6. And then maybe, hopefully, at some point, your immune system will start to counter-react and eventually you will move gradually backwards. Basically, during the hospitalization phase, doctors trying to do as much as possible to prolong your stay within this phase and not go into critical phase when you require a mechanical ventilation. And the same, when you're in a critical stage, they are trying to prolong your life so that maybe your immune system will fight back and you can survive. With all that knowledge, my question now is how many people actually survive the critical phase? It's pretty hard to find a good data online. There are lots of speculation and rumors, but I found this World Health Organization report on China. They say that 6.1% of tested people are landing into critical phase and 3.8% are dying. Some of these people might have died during different phases for different reasons, for example, heart attacks. But in the majority of the cases, you first land to the critical phase and then you die. The rough estimate of death rate of critical patient is 62%, which is sad. It means if you land into emergency room, you will most likely die. To understand better what happens within this critical phase to the patients, I found this clinical study from a specific hospital in China. 710 patients were admitted to the hospital. 658 were hospitalized but never required a critical phase, and 52 of them reached the critical phase, and 20 of them survived. The death rate is the same, 62%. The shocking thing for me was that only 71% of critical patients were actually required mechanical ventilation of their lungs. Apparently before mechanical ventilation you tried some simpler procedures, and one of it called high flow nasal cannula oxygen therapy. Basically you're breathing from scuba with a special mix of air to improve an oxygen intake. It doesn't require any complex or sparse medical equipment, which is very good news. The most important question now, what is the death rate of mechanical ventilation? And the very sad answer is it's 81%. Basically, if you reach that stage of the disease, you will most likely die. Now, when you look at Italian doctors, which apparently excluding certain patients out of mechanical ventilation, it's not really a choice between life and death, but the choice between 10 extra days of suffering life under mechanical ventilation or some peaceful death at home. To summarize, mechanical ventilation system is the most sparse resource in coronavirus treatment. If none of these devices are available, the death rate will be increased by 20%. Therefore, if the normal death rate is 1%, the death rate without this device will be 1.2%, which is bad, but definitely not 10x. And I totally agree that 20% is worth fighting for. So please, dear governments, buy more of these devices and we regular people gonna stay at home. Thanks for watching. Don't forget to like and subscribe. Bye.